as we do so, you'll note that some of these line items or these bullets that I have exemplified tend to be those areas that organizations trip over on a regular basis. And it's not that you can't solve for them separately, but if you're an organization of any decent size and you have multiple systems that are feeding, EMR and credentialing and the payer and the HR data and so on and so forth, perhaps even CRM systems, then you're going to have to be able to have a centralized means to manage some of the attributes that you're seeing displayed on the screen today. So as I've worked with clients across the nation, the bullets that you see on the screen are really the ones that as they get into master data, they start to see the really significant impact it can have on the organization in making data available. And the ones that you see on the screen are the ones that once they get to that level of maturity, they can introduce these, they can bring these to the table, and they can really start to make some strong gains across the organization.